I can always just put, if it's not.
Okay, I'm recording. Okay.
Yeah.
Okay, Betsy's here. Two Betsy's are here. This is great. Okay. And it's really not live?
Not yet. But you just go ahead and I will.
Go ahead. I'm going to be here now. Hello, everyone. Hello, Sunday afternoon, early evening. I'm Lisa Reynolds, and I'm running for Oregon House District 36 as the Democratic candidate. And this is our umpteenth virtual town hall. We're doing them every month this summer, and we'll be picking up the pace after Labor Day as the campaign begins in earnest. I have quite a few guests here tonight, besides, of course, all of you who are just here to join us, but some guest speakers tonight. And we're going to start with Amy Wexler and Franz Bruggemeier, who are attorneys and staff at the Oregon Justice Resource Center. And one reason I thought it would be great to have them on, first of all, Amy and I are good friends, as she is with many people on this call. And as I said to Amy just has a way of really kind of encapsulating what the issues are and what the actions are that need to happen. And I've met her years ago with Moms Demand Action, and her work there is fierce as well. But through both COVID, especially as we're seeing the outbreaks in prisons, and our second prison death this week of a prisoner, second death of a prisoner this week, and the Black Lives Matter movement, I kind of sit back and like, there ought to be a law, or, there should be some legal, steps we can take to counteract some of the tremendous injustices that we're seeing. And the Oregon Justice Resource Center, of course, has stepped up to the plate. And I think, Amy, if I can turn it over to you to maybe kind of tee up how you envision you and Franz presenting, what you and I had, what the three of us had kind of talked about on email. So without further ado, Amy Wexler, who's the Associate Director, I had to look up your title, of OJRC. Take it away, Amy.
Thank you so much, Lisa. And I've had the pleasure of working with Lisa and helping with her campaign during the primary, and I'm a big fan, big supporter of Lisa, and always happy to do this, and can't wait for her to be in the state legislature starting very soon, January. So yeah, I mean, before pre-COVID, OJRC has done a lot of work. We have kind of 5 main project areas. We're kind of best known for the Oregon Innocence Project. We also have a civil rights project. And I don't need to go into all the things we're doing, but our civil rights project was doing all sort of conditions of confinement cases, protester cases, kind of a wide range of things dealing from first interaction with police to how your time might be spent, or however poorly it might be while you're being held in custody in Oregon. And then when COVID came along, in addition to it scattering us all to our homes, it also shifted a lot of our focus, and we ended up bringing several suits that are related to vulnerable populations that are incarcerated. And Franz is going to talk about those cases. He's one of our civil rights attorneys. I'll introduce him momentarily. And then the murder of George Floyd and the subsequent protests that have brought everyone out into the streets of Portland and cities across the country. And then the backlash by law enforcement has now brought another round of cases that we've started working on related to police brutality. So we really had a full workload. It wasn't like we were looking to add, a huge tranche of cases to our docket. We really, honestly, I used to say to myself all the time, pre-COVID and Black Lives Matter protests, like, how is this all happening? How are we doing all this? And then all of a sudden it became like twice as much. And it's like, wait, now really, how are we doing it? So, and also not sharing workspace, which is that much harder. So our Civil Rights Project has 2 attorneys who work full-time. Juan Chavez, who some of you may have seen, he was sort of the attorney from the office who was doing quite a lot of media rounds as the feds were in town. And then Franz Bruggemeier, who's on the call with us today. And then we have a half-time attorney, Alex Meggitt, and Alex splits his time between the Oregon Innocence Project and our Civil Rights Project. So Franz has got his hand in, I think, I mean, there must be some division of labor, and I don't know how it works, but in all or most of the cases he's about to tell you about. And, you know, what I do largely for the organization is I raise money so that we can keep the lights on and keep these cases rolling and make sure that the civil rights of the accused and incarcerated are protected. I have a law degree, but I don't practice. So I get to be law adjacent and appreciate it and look on in admiration as Franz and others are doing their great work. So I'm going to let Franz talk about the cases. And Franz, you could do that in whatever order makes sense to you. And then I guess you can hit it back to me at the end and I can just sort of wrap up a bit. Does that sound good, Lisa?
Yes, that sounds great. Thank you.
Okay, great. And on speaker view, I have you as the speaker. I don't know if you want to spotlight Franz when he's speaking, just that might make more sense.
Oh, okay.
But I don't know if that's how other people are seeing it too.
Well,
You
when
can
I
kind of set it up any way you want, I think.
Oh, okay. So maybe it's just me. I just thought for Facebook and stuff, it might be.
Yeah.
Okay, go for it then.
okay.
All right. Well, thanks for having me. Lisa, you did a great job saying my name, Franz Bruggemeyer. I'm a staff attorney with Oregon Justice Resource Center, Civil Rights Project. Yeah, I mean, like Amy said, we had a lot of things going on even before this, but you know, I'll talk about the two cases that we've been spending a lot of time on since about March or so. I'll just go chronological. We've got the COVID in prison lawsuit where we're suing basically all of the policymakers for Oregon Department of Corrections and the governor to provide better prevention policies, better prevention in action for prisoners all over Oregon. So 14,000 plus prisoners. You know, I think we started it because, you know, I think as we were thinking about it, you know, as Amy said, you know, COVID hit and we all, you know, went into our homes and we all went into social distancing, and that was the thing to do. And we had started thinking like, you know, who's not going to be able to social distance, who's most at risk, who has least control over their circumstances and their safety with COVID. And we were thinking that's probably prisoners. And then we started hearing from folks inside and realized that that is definitely the case. You know, what we were hearing is that, you know, folks were not getting any sort of guidance on that. They were definitely not able to social distance, and they're still not, right? So I guess the first reason that we brought the suit was to try to get immediate action by DOC and the governor. And that could have looked like a lot of different things. You know, ideally what we and our clients and our experts were saying was, you know, that folks inside need to be social distancing. That's the thing that's going to keep them the safest, right? What that would take, though, is thousands of people being released, right? And I think, you know, early on, the governor was asking or was sent from DOC a list of thousands of folks that kind of met these criteria of, you know, non-violent convictions, you know, 6 months or less to go in their sentence, a year less or less to go in their sentence, that kind of thing. And got a list of a couple thousands of people. And almost immediately we saw a kind of weak letter from the DA's Association that said that they opposed it. And then we heard that the governor was not going to do anything, right? And months later, you know, the governor has a new list and has okayed the release of 57 people. Which I am super happy for those 57 people. Very happy for them. They're, you know, they were at high risk of severe effects of COVID if they were to get it. but 57 people protects those 57 people, right? 57 people being released protect those folks. It doesn't allow for social distancing. It doesn't produce any other changes inside for the rest of the folks. So, you know, what we did first was we tried to get a temporary restraining order, a preliminary injunction, trying to get, trying to ask the federal court to either, well, to do all of the following. You know, there's some weird legal reasons why we couldn't straight ask for the judge to release people immediately. There's some laws that prevent that. Then it would need to have some sort of failed action first, and then a panel of 3 judges. And so we wanted to get that first step going, right? And so we were asking for the court to order the Department of Corrections to do a bunch of safety prevention measures, right? Asking for masks, asking for better testing, asking for better social distancing wherever possible. And, you know, the court under its kind of pretty high bar for a stay or for a preliminary injunction, the court wasn't into it. Court rejected that motion of ours. And so since then, we've just kind of been, we're still trying to contact as many folks inside as we can. We still have a questionnaire going out to folks just to get the feel for what they're seeing, what they're feeling, what they're experiencing inside. And what we've seen throughout, you know, since COVID first hit, just in general, not even in the prisons, is that whatever the policies may be, that's not what people are seeing inside, right? And I think that that's the biggest problem that we're seeing, and that's the thing that's creating the most fear, is that kind of action by people on the ground in prisons that are making prisoners less safe. And so where that's at right now is the state is fighting it. Of course, they're trying to get a couple of our causes of action thrown out. So that's where we're kind of in that middle piece. We're in discovery. This is now it seems like, you know, what we're doing is kind of 2-prong attack. One is trying to get that information of what's going on inside, and if we can see anything. So the CDC put out some pretty weak guidelines just because, you know, the CDC can't say to prisons all over the country, hey, you need to release people. Like that's not their role. So they're doing a bunch of harm reduction stuff. And so they've got some guidelines, and that's kind of what we're seeing across the country in a lot of these cases, is that the courts are really looking, are prisons and jails following the CDC guidelines? And so, you know, that's part of what we're looking. We're still looking for ways that we can help people now with possible TROs or preliminary injunctions to help keep them safe where we can. But then we've also got another prong of the case where it's a damages case, where people, you know, it's more of the long-term, you know, years-long class action of, if people are harmed, if they get COVID, if they're harmed, that we're looking for monetary compensation for those folks inside. And so that's kind of where we're at right now, is kind of that long term. And then, you know,
I was gonna say, I think that, like, isn't it true that we're hearing that a lot of the correction staff aren't wearing masks, like they aren't doing the very like minimal thing even themselves, and they're going in and out of the prison all day long? Well,
yeah, I mean, we're
day.
definitely hearing, you know, the mask thing has been a weird thing. So when we were at the preliminary injunction hearing, we were saying, come on, at least order some masks, that the DOC has to have COs and staff wear masks. And DOC says, you know, we're looking into that. Months later, they come out with this really weak, really apologetic letter to all staff saying, I'm really sorry. We don't really want to do this. I'm sorry, but you have to wear masks. Sorry. And that the tone of that letter, and while it said that if if you're within 6 feet of other people and you're not wearing a mask as a correction officer or staff, and you're not wearing a mask, you can be told to put on a mask, and if you don't, then you can be sent home without pay. And what we're seeing is that the COs and staff have a lot of excuses of why they're not wearing masks. And so a lot of the loopholes, they're kind of pushing at those loopholes of like, oh, I'm 6 feet away, don't worry about it. Or I think, what we're seeing too, or what we've heard, is what we've been seeing around the country too, where people are like, I have a mask, it's mesh. Or I have a mask, it's, something ridiculous, fishnet stocking or something, right? But it's a mask, so you can't tell me what to do. And while they're just putting people inside at risk, like the people inside are not at risk to create COVID inside on their own, right? They're only at risk because of COs and staff coming in and out. And so I think there's a lot of things that are not happening on the ground, even if there were policies that were solid.
Well, I was going to say, and I did, I was looking at workplace outbreaks of COVID, and of the top 5 in the state, 3 are prisons, including one that was actually proposed to be closed last week, that the Oregon legislature neglected, I think the Snake River or Snake something. But at some point it's going to be really dangerous for the staff. I mean, it's kind of ridiculous. And then the other thing is, Governor Brown's masking order for indoor spaces was for public facing, but she has tightened that up. I think it went into effect last week, that all indoor workspaces need to be wearing masks when social. So whether, like you mentioned, whether these increase or, tighter restrictions make a difference in the culture of the prison remains to be seen. But at least now there's a, executive order or whatever that they need to be wearing masks.
Yeah, that's interesting because I remember the first one that she put out about wearing masks specifically excluded corrections. So I wonder, I haven't seen the newest one.
That's I look into that. That's really interesting.
Yeah. So sorry, I'll just quickly go into the second piece. Sorry, I kind of went off on that one. So the second suit that we are partnering with a couple of other small firms around the Portland area on this one is the protester suit. And so what it did is it originally tried to get the federal court to say under the First Amendment and Fourth Amendment that using tear gas on crowds to disperse them is unconstitutional, and try to get tear gas being used on whole crowds, to be banned. After we filed suit, the police have shifted kind of tactics to use different uses of force. And so we've kind of added those as they have become a problem. And so what we started seeing was, instead of using tear gas all the time, they would just go in and shove people with batons and pepper spray them and shoot them with impact weapons, right? So what you're probably be hearing as pepper balls, which are not these nice pepper balls that they sound squishy and soft. They're hard plastic. They're not round. They're pretty horrible. And then there's bigger ones that are more commonly called rubber bullets that are 40 millimeters. They're big. They're like rocket launchers almost. And so we've seen this kind of development. Then we saw, the feds came in and they just did everything, didn't care. And PPB got a break and seemed like they were not even a problem at the time, because everyone was just worried about how bad the feds were. Feds, pulled back, and now we're seeing PPB just be extra ruthless again. The stuff that I've been seeing, especially over the last couple of days, just shows what I think what we are all concerned about, even to start this, is when you have demonstrations that are this long, PPB has just ratcheted it up step by step by step, day after day after day, right? Like they do something and, you know, nothing happens to them yet. So they ratchet it up and they ratchet it up and they ratchet it up. Right. So to the point where, you know, last 2 nights we're seeing police jump kicking people with shields and just jumping on top of them repeatedly. Right. A police officer last night just grabbing and stealing someone's guitar. Right. The guy was just playing his guitar next to him, and the cop just takes his guitar and then takes it into the street and says, if you come onto the street, I'll arrest you. And the guy's just distraught, right? We're seeing police just slashing tires left and right of cars, breaking windows of cars that are not even moving. I mean, it's completely out of control. And so what has started with, you know, us trying to get a federal court to say you can't use kind of indiscriminate. That's the part that violates the Constitution, right? Is that indiscriminate use of force, right? If someone is committing a crime, or police have reason to believe that they're committing a crime, and they need to use some sort of force to take them into custody, that's the Constitution allows that, right? Reasonable use of force to arrest someone, but we're not seeing that, right? We're seeing just straight up uses of force to punish people for speaking out, to punish people for their speech, for using their rights of free speech, and it's become pretty terrible. And so I think what we're looking at is we're still going on what we intended to do, and we've recently filed a motion for the city to show why they're not in contempt for some of these uses of force that are just, you know, from our view, completely unreasonable and for no reason, right? People are backing up in front of the police line, and police just start spraying them, right, with pepper spray. Like, they're doing exactly what they're supposed to be doing. They're not resisting. They're just walking slowly in front of the police line, and they're getting hit. They're getting sprayed. They're getting shot. Their signs are being snatched and destroyed for no reason. And so, yeah, the next piece of this is that contempt, and we'll see where that goes with that. We'll see what the court has to say, and then that's another ongoing one where you know, part of it is us, the suit on behalf of Don't Shoot Portland and three other individual activists. The aim is to both try to get some of those weapons use kind of banned. I think what I would like to see, hopefully, is that it seems like there is some political appetite for a ban on tear gas. I think the legislature tried to do something, and then that the same night that the governor signed that into law, the police just decided, oh, all we have to do is call it a riot, and then we can use tear gas, right? They created the legislature unwittingly just created a playbook of what they can do. So, you know, announcing something that a demonstration is an unlawful assembly or a riot, there's no legal reason. There's no guidelines on what they have to check off to make that call. So what we're seeing is, like last night, they just declare a riot and do whatever they want. And so we're trying to prevent that.
Yeah, and in that case with Don't Shoot Portland being our client, we did win a temporary restraining order saying the police can't use tear gas unless life safety was at risk, I think is the term they use. But and then after that, then the legislature said only in the case of a riot. So the police sort of have these like windows that they can say like, well, we're not violating the temporary restraining order because we're only doing this when, you know, someone's life is at risk. And I think what the judge really was referring to is like, listen, if there's, you know, if they're, you know, like setting a building on fire and people are inside the building, use tear gas. But that's not what people are doing. I mean, you know, and actually Dr. Lisa and I have been in the streets together and seen what's going on firsthand. And it is not what's, you know, the use of tear gas is indiscriminate. It isn't directed at one person, which is part of the constitutional problem, as Franz had said. So I also am hopeful that the legislature will take action, which might be before Dr. Lisa Reynolds gets in there. If there's hopefully going to be a special session in September, but if not, when you get in there as a doctor, I know this is something, and as an activist, this is really important to you. And I mean, this is actually, we have 2 other cases, at least I only can think of 2 others. I don't know if there's more than that, but the Muslim family with the pregnant mother who was indiscriminately tear gassed. And then also a Black Lives Matter activist in Prineville who was targeted by the mayor of Prineville. And I don't know if you want to say anything about either of those cases, Franz, or if I'm forgetting other cases that there are in the protest arena. There might be. They're filing lawsuits so quickly, it's hard for me to keep up.
Yeah, I mean, I think that's the thing. The Muslim family was from June 2nd when the police just absolutely tear gassed all of downtown repeatedly for hours and just chased people around shooting tear gas at them. And I think that was basically that night, June 2nd, was the reason for us to file that lawsuit in the first place. And it's kind of shifted since then. I think there are a couple of other like small damages cases for people being hurt by being shot or by being hit. And we're definitely looking into those. It's at this point, it's just a matter of having the time to do all those. I think over the next 2 years, which is kind of like the statute of limitations for filing lawsuits on these things, we're going to see a ton of damages cases where people were injured, people were harmed, and the city's going to face a lot of lawsuits over the next couple of years.
And it's not even it's not just people who are protesting. I mean, the neighborhoods, right? And one of my colleagues, Erica Mosen, is a pulmonologist who writes widely about this, and she helped design a T-shirt. And Amy, if it's easy for you, if you want to do a link to that, a T-shirt about tear gas, takes lives. I'm so terrible. I can't remember the exact thing, but it's a pretty dramatic T-shirt that talks about the effects of tear gas, and the profits from the sales of the shirt goes to OJRC. So. Yeah.
Well, I don't know if we've taken up all of our time, but
Sorry.
No. I mean, you were the bulk of it. I just wanted to, say, to everybody here or anyone who's watching on Facebook that we're, OJRC is powered by support from the community. We can't pay Franz's salary without that. So, we're grateful for any support we can have, and certainly buying a T-shirt from there, or any donation, or even like $5 a month donation online. Anything is super helpful for our work. So, if you want to support not just the civil rights of those who are currently adults in custody, but the civil rights of all of us, we'd be grateful for your support. And I'm super grateful for Franz for coming on today. So
thank you both so much for being here. And Amy, if you want to put like a link to the website, or that would be great in the comment section.
I'll do that, and I'll get the T-shirt too. Great.
And I will get back to you all. There's been, certainly in the chat, there's been comments on, what can we expect of the legislature? Can we be calling our legislators? Certainly never hurts to call your legislators. I do know that, as Amy alluded to, there is going to be another special session in September. I don't know if tear gas ban is on the list. I've heard some concerns, almost like the riot thing. If we ban tear gas, will they use other things, other methods of crowd dispersal or crowd control that will be as noxious? So I know people are looking at it, and I will definitely be doing a follow-up Facebook post, social media post on things that come up in today's town hall, and I will including resources to connect with OJRC. So we'll make sure that that's all available to you, and I'll do a little digging on where we are with tear gas at the state level. Thank you, Amy and Franz. Thank you all for being here. And then I'm going to shift gears here a little bit. I'm going to introduce Ruthie Condi, who is an amazing woman in her own right, but has a special connection to me because she's Doreen's daughter-in-law. And she is she's been a Head Start teacher and is now an administrator, if that's the right role, supervisor with Head Start. I actually was a guest in Ruthie's Head Start classroom probably about a year ago. I can't remember. And it was really, really lovely. But, Ruthie and Doreen and I have been talking about the needs of Head Start and how we can support this really important program. So without further ado, I want to make sure Ruthie is unmuted. You are unmuted.
Awesome. Yeah, so my name is Ruthie. I work for Neighborhood House Head Start, which is services Southwest and Northwest Portland. We have a center in Northwest, and we're just opening a new center in Southwest and in Northwest. So we service around like 205 families, both from 0 to 5 years old. And for those of you who don't know what Head Start is free preschool for low-income families. And also we do pretty intensive home visiting for families with kiddos that are 0 to 3 as well. So when COVID hit in March, we closed down and we did distance learning, which was pretty challenging for our families because many of them have multiple kids in their family, as well as not access to internet or like devices to do distance learning on. So we did the best we could with what we had, did a lot of phone calls and stuff like that, but are now looking at trying to reopen in some capacity when the fall comes with smaller class sizes, and we're getting a lot of guidance from the early learning division on how that's going to look. But our biggest barrier is making sure that these families have access to the distance learning through providing technology somehow. So, the whole reason why Head Start is created is to give these children a little boost because they often are the ones lagging behind when they get to elementary school. So this is important for them to be able to interact with their teachers in this way, even at this young age. So we are looking for, any sort of devices that anyone might have that is lightly used, whether it's an iPad or a smartphone or any sort of tablet, old laptop, anything that a kid could, get on and interact with their teacher on. And we also are always looking for donations as well. So I can put my contact info in the chat, and you can reach out to me. Lisa, is there anything else you'd like me to speak to?
No, I think it's great. I mean, when I was talking to Ruthie about this, I really thought I think I have 2 old iPhones here that we were always going to sell on eBay for like $18 and never did.
Yeah.
So I just wanted to give Ruthie this, this wider audience if you all have stuff. So you can reach out to Ruthie directly. But it's from what I can see, the schools aren't asking for this type of support, the K through 12. And it seemed like this would be an opportunity if folks have things kind of moldering around their house. I have a couple old Chromebooks that I'll obviously check and make sure at least can turn on. And Ruthie feels that her staff would be able to recondition things that need to be reconditioned. So if that's something you all want to help out with, and if I can help deliver stuff, just let us know.
Yeah, and I would also be happy to come pick up anything as well. So, yeah.
Great.
Thank you so much.
Thank
I will
you.
put all that
for your time.
information.
Yes.
Yeah, thank you.
Thanks. And if you guys have questions or concerns, just chime in.
Does that stay up, Lisa, after we're done here, so we can get to this contact information, or how does that work? It does? Okay.
Yeah, and also I will make sure that I type things up in a coherent manner and put it on social media, and I'm happy to send it to you all as well.
Great, thank you.
Yes, I know. It's hard to feel like you're having to take notes. Take notes. Hey, I just want to talk about a few more things before we sign off. But of course, if you guys have questions about anything, let me know. I'm looking at my notes here. So COVID, we still are in the pandemic. There's been, I will say, I looked at the graph today. I look at the graph on the New York Times every day, and Oregon is starting to come down a little bit. And I would say that, right now Oregon has had, 22,600 cases and almost 400 deaths. And about 10% of those cases are in kids less than 18 years old. And these are the numbers that we're starting to see nationwide. For a while, there was, and we've talked about this a lot in this venue, there was this thought that kids can't get COVID, kids can't spread COVID. And it's very clear that kids can get and kids can spread COVID. But I will say, for the most part, the kids do okay when they get COVID. Very few kids with COVID are hospitalized. There's been, I think, 30 deaths of children in the whole United States due to COVID. Always tragic, always awful, but obviously the numbers are very different than I think we're at, 170, 180,000 deaths across the US from COVID. So very small percentage of kids are dying from COVID, but they do get it and they transmit it. And this is why the school openings have been so fraught. And I think of an important note is that the percentage of the COVID cases, I'm playing around with the gallery view. The COVID cases have gone up in children, have gone up 90% in the past 4 weeks. And I suspect that's a function of some schools trying to open, and I suspect it's a function of people relaxing their protective measures. There is this multi-system inflammatory syndrome in kids. We've had one in Oregon, and that child completely recovered. It's what we call a Kawasaki-like kind of full-blown inflammatory response. That's kind of a post-COVID complication. But the state of Washington has seen 11 kids come down with this very severe complication of COVID in kids. I don't know if any of those children have died from that. So it's not nothing. You guys probably heard a little bit about some of the criteria Oregon needs to meet in order for schools to open. There's kind of some county criteria. It's basically 30, I want to make sure I get this right, I'm looking at my notes, less than 10 cases per 100,000 people in a county over a 7-day period. Right now, Multnomah County's at about 57. So we're like 6-fold where we need to be in order for schools to open. The K through 3 has, and maybe even Head Start has a lower threshold, which is less than 30 cases for 100,000. I mean, it's kind of a higher threshold, but easier to meet threshold, 30 cases per 100,000. Multnomah County is twice that right now. So I think the whole idea is if we can really get the background of COVID much lower, it will be easier to prevent widespread transmission in the classroom setting. And I think that's worth trying. We're not there at that low threshold background. I've had some people who say we can't open schools until we have a vaccine. I'm not there yet, because I think that's, we're talking, 9 to 12 months from now, I think, for that. But if we can really get these threshold cases down, that would be really awesome. I've been a little bit concerned that we're not where we need to be, and I'm not exactly sure what the roadmap is to get there. So with a group of physicians and just general public and several unions of folks who are on the front line, such as the Oregon Nurses Association and the United Food and Grocery Workers, it's not grocery, commercial workers, I always forget the name, with AFL-CIO, with, there's a group of us that probably represents over 100,000 Oregon workers have banded together to form the Oregon Public Health Coalition, which really lays out what we think needs to happen in order to bring these cases down. And none of this is rocket science. It's all stuff you know. It's all stuff we've been talking about, you know, more widespread measures on masking. And the governor did do that with this latest one, that all workplaces need to wear, folks need to wear masks. We need, I think, a stronger mandate around masking. It still feels like it's like, please wear a mask. Maybe a little bit like what Franz was saying, like, oh, we're so sorry, but you need to wear a mask. You know, a more robust, much more robust testing, much more widespread, more available testing. Oregon is one of the lowest percentage of testing levels in the country. And it's gotten a little bit easier in the past week. It's week by week for me in my practice as to how easy it is for me to get a test for my patients. And then a robust system on contact tracing of quarantining those folks who have been exposed to someone with COVID, isolating those folks who are sick with COVID. And then we are still way behind in PPE. I know it's hard to believe. We're 6 months into this, just about 6 months into this, 5 months into this. So we're really proposing some innovative, homegrown PPE. You know, we are an innovative state. There's a lot of apparel makers here. So we're pushing the state to think about robust partnerships where we can have better PPE. So the announcement of that definitely had a little bit of, made a little bit of a splash. It was covered by KXL, which is actually a fairly conservative radio station. And it was on KATU News, and I was interviewed by Willamette Week. So that's made a little bit of a splash, which is great. And now we got to kind of get down to work. So we'll be meeting as a group and figuring out where we can, how we can provide a little bit of guidance and really cover for the governor to make more widespread and more, I should say, strict public health measures. So looking at my notes here. Great. My campaign is going to have our official launch on Tuesday, September 8th, which is the day after Labor Day. Join me here at 5:30. And I have a couple other events coming up. I'll just post this all on social media. No need to list those here. Although I do want to highlight Doreen, who on my screen is right next to me. Hi, Doreen. Doreen and I are doing, you know, we have a little show we do. We've been doing a series of events since COVID started, where I'm kind of the medical part of it, and Doreen is a psychologist, very gifted therapist, to kind of help guide families through these difficult waters. And I was actually going to turn the floor over to Doreen here for a minute, just to give your thoughts on what you're hearing from families. Boy, when Portland Public Schools, Beaverton School District, how many others announced officially that they weren't going to be able to open in September. I know that, you know, it was certainly kind of a cause for relief for some of us, but obviously some tremendous anxiety for a lot of families. Any thoughts or pearls of wisdom for folks going through this, Doreen?
I think the big thing that the big thing that I am telling folks right now, I've been doing a lot of distance events with school districts. I was with Seattle School District this last week with 600 parents. And so I was fielding questions from 600 people, and they all boil down to a couple of issues, which are, how are we going to handle this? And how are our children going to fare? And the big thing I'm just telling people right now, if you have school-age children, it's really important that you grieve the big losses and that you also really reset your expectations about academics this year. This is not probably going to be a semester where we're going to thrive academically, or where children are going to, you know, really get a huge boost in their academic learning. But we can really teach the important skills of emotional regulation during this time. And I think that's something that we can really put our positive energy toward. So I'm encouraging people that as they think about how to do the fall, to really think about norms that will put in place some really important helps, like different zones in your home: a zone for work, a zone for recreation, and a zone for rest. Some of those where no screens go. And then really kind of boosting your home's ability to stimulate all of our sensory awarenesses, our sense of smell, or the things we can touch, because a sense of disembodiment really does impact both our learning and our emotional regulations. We have a couple weeks to boost those things, and Lisa and I will be covering more around all of this on Tuesday. The one big thing I'm telling everyone that could make a huge difference both on our emotional sense of overwhelm and our intellectual sense of overwhelm is to try for at least a small portion of each day to stop multitasking. Now that we work and live and school and exercise all in one space, we do everything at once, and it is incredibly toxic on our neurological functioning and our emotional well-being. So take some period of time every day where you're just doing one thing at a time, and that will really help with the overwhelm.
Thank you. And yes, this is just a glimpse of what you can all hear if you join us Tuesday at 5:30, which is Doreen and I talking about kind of back to school in the age of COVID. Great. Well, I'm seeing, thank you all for being here. A lot of the people on this call are some of my most ardent volunteers, and you will be hearing from me about how we can start getting back into Lisa for Oregon campaign mode, with the understanding that there's some other really, really, really important elections this fall. And if you want to get involved in any other election work, Trump, US Senate, important House races, I think your one-stop shopping can be with Indivisible Oregon, which is indivisibleor.org. Okay. And I'll include that in I'm going to do show notes after this event. I really appreciate you all being here. And I am kind of getting into my campaign mode, and I'm pretty excited about that. Although I'm just like sticky and warm right now. I was saying to some of the people early on, like, something really weird happened with the barometer today. And now it's just like, it actually reminds me of LA in the 80s. It almost seems like sooty out there. I don't think it is. I think it's just, yeah, gray, and it kind of rained. And yes, did you have something you want to say, Doreen, about the barometer, I hope?
No, it's about, you had mentioned that you were going to be talking about the USPS, and I wondered if you wanted to.
Oh my gosh, yes, too many things. So, and again, I'll include this in my show notes after this event. So as you know, the US Postal Service is under attack by our president, by the current Postmaster General, whose last name is DeJoy, which is one of the most ironic names I've ever heard. They are removing sorting machines, which sort like 35,000 pieces of mail per hour. They're removing post boxes, including, mailboxes. Up to over 30 have been removed in Oregon, something like 25 in Eugene and 7 or 8 in Portland. So there's a real slowdown in the mail. And as a physician, we all know that a lot of our patients get life-saving medication through the post office, and patients are seeing a delay in that. I think there will be yet more blood on the hands of Donald Trump because of this. But the completely unveiled intention here is to slow down the mail, getting ballots to voters and getting ballots back to polling places. So we are lucky here in Oregon. We're used to vote by mail. I know we'll get our ballots, and we have drop boxes that we can bring them to, not mailboxes. And we'll be talking about that as it goes forward. But some things we can do to save the U.S. Postal Service is to call your senators, Ron Wyden, Jeff Merkley, call your members of Congress. That's for this call. It's mostly Representative Blumenauer or Representative Bonamici. But also Smitha, who a lot of us know, came across, she had this brilliant idea. There's a board. They're all old white men who are CEOs of insurance companies and banks and venture hedge funds and things like that. Yep. Thank you, Judy. Judy's holding up the picture of the old white men. And I have a document that includes their emails and their phone numbers, and board members do not like to be bothered. This is, they kind of see this as a ceremonial public service thing. So we want to fill their inboxes, their email boxes, and their phone voicemail. So this, I kind of was thinking there's 6 members of the board, there's 3 members of Congress, so 9 phone calls a day. I mean, if you did that 5 days this week, I think we could maybe turn this puppy around. So I will post all that information as well. Did you have something else you wanted to say, Judy?
I was just going to say today, I thought I would start on the phone calls. I already emailed each one of these guys. So I tried to call the phone number listed for Robert Duncan, who is the chair of this group. And I just got a bank like message thing. So I didn't have his particular extension, so I couldn't get to it. And I thought, well, I could just harass the poor bank manager, but that isn't really fair. So I hope we can maybe concentrate on the emails first. And then if people do find specific phone numbers at work, let us know.
Yeah, I bet that will come, right? I can just see someone getting on that like a,
Yeah.
yeah, great. Well, awesome. So nice to see your friendly faces. And Amy did comment, yeah, maybe this is the Gorge Fire. I don't know.
Oh, I bet you're right.
The soot, the Los Angeles soot. I know
I
there
was on the Sandy before coming to this, and some people there were saying they thought that this was from the Gorge Fire, and it makes sense to me.
Yeah.
Bummer.
Can't quite smell it yet.
Right.
Yeah, but just, yeah, and even just being that a little bit closer to it, the air did feel that's, sort of reminiscent, not as bad as it has been, but reminiscent of those fires that we've had in the previous Augusts.
Wow. Well, great. I mean, not great.
Not great.
Bad.
Yeah. Bad for everybody with lung issues, and we have a pandemic. So
Right.
And yeah. So don't go to the protest tonight if you have lung issues. Let's not do the double whammy of the smoke from the gorge and tear gas. Now, I don't mean to be flip about that, but I mean, it's obviously there's so many things that are very, very difficult and fraught right now, but I'm getting pretty hopeful about November. I am acting as if we are 10 points behind in every race we're doing. Not my race though. In every race we're doing. And then we got to work like heck. And I know a lot of people on this call are already doing that. I think Kamala Harris was a real shot in the arm for me. I had a much more like joyous reaction than I would have anticipated, and seeing that has been exciting. So thank you all for joining me, and I know your time is very valuable. Thank you for being here tonight. Thumbs up to Dick, and we will plan. I will do some follow-up stuff, especially in my social media, and try to also email the folks who are on this call in the Zoom room. And it was just great to see you. And our next event is Doreen and I, Tuesday at 5:30, and then my general campaign launch event, Tuesday, September 8th at 5:30. Thank you all.
Thanks.
Bye. Bye. Have a great evening.